Everyone is eager these days to get back to a more normal summer. We get it. It's getting a little old being at home so much.
Whether you're looking to just get out more or you're wondering if it's a good time to see relatives while the pandemic is ongoing, there are so many questions about how to proceed safely.
Yeah, so morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Well, with so much of the focus this year on COVID-19, the eagerness to get out and about is definitely there. It can be easy to forget some of the everyday risks that can happen every year. So I spoke to Dr. Josef Thundiyil, an emergency room physician at Orlando Regional Medical Center in Orlando, about some precautions. First up, we know it's hot out here in Central Florida, but don't forget to take care of yourself when it comes to the heat.
I think the first thing is just to be aware of what the things are that we see. First off, we see a lot more illnesses related to heat. So we call them, they range from what we just call heat exhaustion, which is just being overtired from being out in the heat a lot. There's heat syncope, where people will pass out from the heat. And then in severe cases, it's heat stroke, where you can sustain brain damage. And a lot of that is related to being out in the heat a lot. It also can be related to certain factors like extremes of age, people who are really old or really young, or who are on certain medications. Those who don't have access to internal air conditioning or cool air right away, and just lack of awareness and not drinking enough fluids are all contributors to that.
Now, the risk of drowning is also up during the summertime, so you definitely want to make sure to be properly supervising children, using pool locks and alarms. These are all warnings that we've heard before, but they're worth reviewing, especially when things have been anything but normal this year. So we also talked about some of the new challenges we're facing this summer, with the threat of coronavirus still looming.
I think there's a false sense of reassurance in the summer because it's hot and it's warm, and we've kind of forgotten about it and feel like this pandemic is behind us. It's not. So things are going to be different. I think be careful when you travel. If you have to go to an airport for some reason, still try to maintain that distance. And then do all the other standard precautions that everyone has been thinking about doing, but don't forget to do them. And that is wash your hands frequently, don't touch your face, hand sanitize. If you're going to be at a workstation or place that you're going to stay for a while, be sure to wipe it down with an alcohol-based or bleach-based wipe. And then most importantly, if you're sick, recognize it and don't go out into the public and potentially expose other people.
And of course, summer often means family get-togethers, but this year that can mean some difficult conversations and decisions.
Yeah, this really is a difficult situation. I think both for the elderly and for those of us who are family members who we can't see them as regularly. And a lot of that will depend, first of all, on what their health conditions are. I think people, the older they are and the more likely they are to have other underlying medical problems, the more at risk they're going to be for getting COVID. The other issue is whether or not you've been to a high risk area. So if you, for some reason, have had to travel to some of the high risk states, which has been evolving, or high risk areas, then you may want to take extra time before you go see those grandparents. And if for any reason you're feeling unwell or you're feeling sick, I would delay any visit to them.
So if you're thinking about summer air travel, Dr. Thundiyil says the best way to protect yourself is by wearing a mask and avoid touching things like handrails, elevator buttons. Also think about the places that you are in an airport where a lot of people like to congregate, like restrooms. Wash your hands as much as possible, and of course, like anywhere else, keep up the social distancing.